is Nikki Coburn, and today I will be doing a Foley catheter on a female. The first thing we want to do when we are doing a Foley catheter is check the MAR and compare it to the physician's order. Make sure there are no discrepancies. Next, you want to check for allergies such as iodine or latex. Once you've assessed those two, you can go ahead and gather your supplies and go to the patient's room. So you'll knock. Hi, my name is Nikki and I will be your nurse today, and I will be doing a Foley catheter. Is that okay? If they say it's okay and they give you permission to do so, you can go ahead and provide for privacy by pulling the curtain or shutting the door, washing your hands when you come in, and then ask the patient to identify by two means. So you'll ask them their full name and their birthday, and then check their wristband to make sure the information is accurate. And then you will go ahead and assess the lighting to make sure you have enough. And then you also want to make sure that you have your trash can nearby. Mine is down here. And I'm standing on the right side of the bed so that my non-dominant hand can work the way it needs to, and then my right hand can be my clean hand at all times. Okay, so once I'm at the patient's bed and I'm ready to go, I will go ahead and position the bed to the highest level for comfort for me. And then I'll go ahead and put this side rail down on the side that I'm working on. And once I have my hands washed, I will go ahead and uncover the patient, only the area that I need to work with. Everything else will maintain privacy. Then I'm going to make sure that the patient is in the position that will work best for me and the patient. So just make sure that the legs are upright and out of the way, almost like a frog leg. So once the patient is in position, I can go ahead and put on clean gloves after I wash my hands. And now we will go ahead and provide peri-care as needed for the patient. So I'm going to make sure that I have some kind of paper towel or towel underneath the patient, anything that'll be absorbent so their bed won't get any urine or anything on it. So once I do peri-care, I'm just going to make sure that I clean the insides and throw away one down the middle, and then one on each of the outside. Once the patient is clean, I will go ahead and dry them with a new rag. And then I can go ahead and discard all of my supplies along with my clean gloves. I can dispose of that. Now that the patient is clean and ready to go, I can go ahead and wash my hands and start setting up my sterile field. And the thing I want to worry about when I am having my sterile field set up is to never turn my back on it. And once my sterile gloves are on, I want to make sure that I never drop them below my waist. So once my sterile field is set open, I can go ahead and reach in and grab this blue placemat by its corner, since I have a 1 outer inch of sterile space. And the shiny side will go down on the bed. And I just want to make sure that I don't reach across any sterile field, including this one. Once that is in place, I can go ahead and take my sterile gloves and put these on. This one I can touch the inside of the cuff, because this will be touching my skin, so therefore it will not be sterile once they're on. Then I can scoop this one with sterile to sterile contact and just scoop it onto my non-dominant hand. And I can go ahead and reposition as needed. Once I have my sterile gloves on, I can dispose of this properly, touching the inside only, which was sterile. Now I need to go ahead and start setting up my tray. This entire thing is sterile on the inside only, so I will grab only the inside and place it closest to my patient so that I don't have to reach across my sterile field. Once this is ready, I can go ahead and take my tray and place it right below the site that I will be working with. I'll go ahead and take my lubricant and open this up and pour it into the tray for my catheter once I begin. Dispose of this. Then I also have hydrogen peroxide here that I will open and pour onto the cotton balls that are inside my sterile field and dispose of that. Next, I will go ahead, take my sterile saline that came in with it in my syringe, take the cap off and I can go ahead and put this onto my green port on my catheter. Okay, so now that everything is set up, I can go ahead and provide for peri-care again with my sterile tweezers and then my cotton balls. So for this, I want to make sure my non-dominant hand will stay on the labia at all times. So once I have this and my saline on my cotton balls, I'm going to separate the labia and clean the inside, discard, clean the other side on the inside, discard, one down the middle, discard, and then one on the outside and another on the other side. And I can go ahead and throw away my sterile forceps. Once that is ready, I just want to make sure I keep my non-dominant hand on the labia at all times to prevent recontamination. And then once I'm ready, I can go ahead and take my entire catheter bag and place it on the sterile field. I am going to take the end of the catheter and stick it in the lubricant about 2 to 3 inches. Once that's ready, I can go ahead and insert the catheter into the urinary meatus. I just want to make sure that my dominant hand never touches the actual skin to contaminate it while the catheter is going in. I'm going to stick it in as far as maybe 3 inches, or at least until urine comes out. Once the urine has come out, I will put it in another maybe 2 to 3 inches until I know that the balloon placement is inside the bladder. Alright, so once it is in, I can go ahead and inject my sterile saline into the balloon to pump it up. And I will make sure to inject all 10 mils. Okay, once that is set up, I will go ahead and pull on the catheter until I feel resistance to make sure that the balloon has been fully pumped up. All right, once that is in place, I will go ahead and start setting up or cleaning up my supplies. And I will go ahead and take off the syringe and throw that away. Then I will make sure that I place the catheter bag below the bladder at all times. So I'm just going to attach it to the side of the bed. And I also want to make sure that I have some kind of a Velcro piece or something, or tape even, to just tape this to the thigh and make sure that they still have room to move, that it won't pull the catheter out, and make sure there are no kinks in the catheter tubing, and make sure they're not laying on it. Once this is ready, I'll go ahead and provide for privacy, move their legs back into a normal, comfortable position. I can go ahead and remove all of my supplies, take off my sterile gloves, and I'll go ahead and wash my hands, and then I will go ahead put the patient back into a safe and comfortable position. Make sure that the patient has their call light and knows how to use it. Once they're comfortable and they've got their call light, I'll go ahead and wash my hands again, and then I will report and record my findings and come back at another time, maybe 30 minutes to an hour later, to assess the procedure that I have done.